This graph is going to explain to you why the NBA season is canceled, NCAA tournament's not going to be played, why Disneyland is closing, and why most public gatherings have been canceled for the foreseeable future. Hey, my name is Nate, lawyer/YouTuber, and today I want to try to explain why the government and these private companies are taking such drastic measures to try to actually protect the healthcare system. Now, for those of you who don't know, COVID-19 is an illness that has caused worldwide panic. Estimates say that this illness is 10 times more lethal than the seasonal flu, and it's extremely contagious. Now, how contagious is it? Well, here's an example from the real world. In New York, we have what I'm calling patient zero. It's a lawyer. Now, this lawyer tested positive for the virus on March 2nd and was hospitalized at New York Presbyterian Hospital. He was taken there by a friend. Now, I'm going to read off a list of people who have been confirmed to have been affected by patient zero. First, patient zero's wife and 2 children tested positive. Patient zero's neighbor, the one that drove him to the hospital. One of patient zero's friends, and that friend's wife. Also, their 2 sons and daughter. Also, 3 members of patient zero's church tested positive. 2 additional friends, and 4 other people who had contact with patient zero. And lastly, 2 bartenders who worked about mitzvah where patient zero attended. In total, 50 people who have been affected can be traced back to patient zero. Now, this brings us to the NBA specifically and their reasoning from canceling all the games. NBA player Rudy Gobert tested positive for the virus on March 11th, 2019, right before the game. Now, who is Rudy Gobert? Well, he's an NBA All-Star for the Utah Jazz. Now, before testing positive, this player had played in 5 games in the previous 2 weeks. Now, in the game before, this player found out that he was positive with the virus. Look at the kind of close contact this player had with other players.
Bucket. Bogey, touch pass, Conley, 3. Bang.
Remember, basketball is a contact sport, so we're talking about a lot of sweating, touching, breathing directly on other people. So the NBA understanding 2 facts that, number 1, this disease is very contagious. For instance, 1 man just spread it to 50 people, and they had an NBA player in active close contact with their other players. How likely do you think that multiple players may be affected from this one instance? And as of the filming of this video, one of his teammates has tested positive. So at this point, I think any contact sports would be irresponsible. The NCAA, the NBA, hockey, you name it. Now, just like to note, the NBA and local officials have placed all the players from the teams listed to self-quarantine. Now, these were the teams that this player had interacted with or played against in the past 2 weeks. Now, it seems that a lot of people are confused about the hype. Why is there so much panic? Why there's so much caution? Especially since the death rate seems to be really low. The president said it's like the flu.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat. People die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. View this the same as the flu. When somebody sneezes, I try and bail out as much as possible.
The issue is actually the strain on the healthcare system. See, with the new virus, this adds possibly thousands of new patients to an already overloaded healthcare system. And this is on top of our current healthcare needs. For instance, you're still going to have people having heart attacks. You're still going to have people giving birth. You're still going to have people needing urgent care for injuries. Now, if you add a new virus and new patients onto an already strained system, then you're asking for trouble. Look at what happened when the virus first appeared in China.
There are new images out of Wuhan that purport to show the dire conditions in hospital. This is unverified video posted on the Chinese social media platform Weibo. It was shot by a woman who claims to be a nurse at Wuhan Red Cross Hospital. The original post has since been taken down. The woman says medical workers and patients were stuck with 3 dead people in a packed hospital corridor and that there was no leader and no one to take care of the bodies. Thomas Yao, a correspondent for the reputable and independent South China Morning Post, says the video appears to be shot in Wuhan, but he can't be sure of all the details or the date it was shot.
Now we get to our graph. On the left, we have the number of cases or the number of infections. And on the bottom, we have time from first infection till current. Now, this dotted line represents the capacity of our healthcare system.
Anywhere in the world, at any given time, in any given city, there's a fixed amount of doctors, ICUs, beds, ventilators.
Now, with prevention, people will still get infected, but the infection will spread out over time, not overwhelming the healthcare system all at one time. This is what the blue curve shows. Now, prevention is achieved by isolating sick people and slowing down the rate of infection. Then the system can handle the load. But that's not what happened in Italy and China. The red curve. Now, this shows thousands of new infections over a short period of time, overwhelming the system. This is why the NBA, NCAA, Disney World, and all of these companies are closing up shop. They're trying to help the healthcare system.
Now, many, if not most of those deaths in Italy are likely a direct result of what we have already seen with this virus in Wuhan, China. The virus is overrunning the healthcare system capacity. Anywhere in the world, at any given time, in any given city, there's a fixed amount of doctors, ICUs, beds, ventilators. The systemic risk the virus poses to everyone around the world right now, including in the US, is what is happening now in Italy.
See, cities like New York understand this. That's why they're telling people with symptoms who are not at high risk to don't go to the hospitals, to actually stay home.
In light of that, if you do have the symptoms, if you have a fever, if you have a cough, if you have a runny nose, if you have congestion, stay home. Simple, voluntary point. Just do the smart thing, stay home. Don't go to work, don't go to school, don't go out on the town, don't go to a restaurant, don't go to a theater, just stay home. Again, if there's no extenuating circumstances like a travel nexus or other things that, or pre-existing conditions, it was just an average healthy person having these kind of diseases we typically have this kind of year, that's those kind of symptoms, call your doctor, let the doctor know what's going on, give it a day or two. If you're getting well, that's great. If you're not getting well, we want you in.
See, the U.S. is trying to avoid the red curve, like what happened in Italy, where they had to close down everything for 2 weeks. They're trying to lower that red curve to the blue curve. Now, I hope you learned something today. Now, this was a super simple explanation of something that's very, very complex. Now, there's a lot of misinformation out there, so be careful. Now, my name is Nate. If you like this video, like, share, and subscribe. And just remember, as always, I just hooked you up.